So for etonogestural subdermal implant, first I'll obtain the appropriate consent from the patient. And I'll have the patient lay down, face up, with their non-dominant arm, likely the left arm in this case, facing towards you. So the way I orient it is this. It's kind of the best way to show it. This part is towards the head, the shoulder, the elbow, and here will be the hand. So hand, elbow toward the shoulder and head. So this will be the left arm of the patient. First, what I would like to do is measure the landmarks here. Palpate the medial epicondyle of the elbow and measure 8 to 10 centimeters towards the shoulder. So I'm going to grab 9 centimeters here and mark accordingly. So that's the 9 centimeter from the medial epicondyle. Then simply I'll spin the ruler and make sure that the sulcus between the biceps and triceps is at least 2 to 3 centimeters away. Okay, so without marking, I just make sure that happens. You don't want to be going into the sulcus where the arteries and the nerves are. After that, going back to the original landmark, measure extra 5 centimeters towards the shoulder from there. So landmark it here. So original, and this is the insertion point, and this is the landmark point. Okay. Now what I'll do is use an appropriate antiseptic to clean this area. Of course, going from the insertion site to the landmark site, cleaning towards that direction. And now I'll apply local anesthetic, lidocaine, with or without epinephrine, starting from the insertion site all the way to the landmark. Because this is about 5 centimeters in length, most local anesthetic needle may not be long enough to reach all the way across. So I may need to have more than one entry point for the local anesthetic, perhaps from here and here. The idea is to cover the entire length with local anesthetic here. Now I'll go ahead with this device here. This is the applicator. It's serrated on this end and here, and that's for me to grab onto very tightly. Make sure that the purple tab is fully retracted, fully loaded. Make sure it's not damaged. Make sure the needle is tacked with the rod inside. Now I'll go ahead and approaching 30 degrees from the parallel, up no more than 30 degrees from the parallel, I'll go into the insertion site just so that the bevel is hidden just underneath the skin. As soon as the bevel is hidden underneath the skin, I'll flatten out the applicator to the parallel and use the tenting method to kind of raise the skin a little bit, and then parallel to the skin, I'll advance the applicator towards the landmark site, making sure that I'm not going in too deep into the muscle layer, and also that I'm not going too superficial either as to puncture the skin second time. Advancing, 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 all the way across until the entire needle is buried underneath the skin. Okay. At this point, I'm going to switch my index finger with my middle finger, and with my left hand, grab onto this end for stabilization, and then fully retract the purple tab until I hear that click. Fully retracted. Letting go now. Now, I'll remove the applicator. A little stump left here. And now, I will palpate for the rod, one end here, one end here. The site will be bleeding, so I'll immediately put on a little bandage here. Have the patient also palpate the rod so that they know exactly where it is. And then finish off with a bandage, pressure bandage all around. And the idea is for them to have the pressure bandage removed after 24 hours and this little bandage here removed after about 3-4 days. Quite simple. Now for removal. So the patient comes back. Expiry date is 3 years. I'll gain the consent. Palpate for the rod, for its location. And if I press the proximal end of the rod downwards, in real people, in real skin, the distal end of the rod should kind of pop up superficially so you know exactly where the entry point will be. So in this case, it's right here. I would apply the antiseptic to clean this area. I'm going to go ahead and mark it. I'll go ahead and make an incision 2 millimeters long. Parallel to the rod, 2 millimeters parallel to the rod. Of course, this would be after I've placed the local anesthetic at the intended entry point under the subdermal implant. So again, inject the local anesthetic under, try to do that under the rod. Okay, now making a 2 millimeter incision here. Not too deep now, just under the skin. Now, take the straight forceps. And try to grab the rod from the distal end and then pull it out. Keep in mind that it might be difficult with all the fibrosis surrounding the rod. Now, if it's too difficult, I'll put it back in now. You can use a curved one. And the idea here is that with your right hand, grab as much as you can of the rod and try not to grab the skin. Pass it on to the opposing hand. And that should reveal the rod a little bit better. And now, grab it with the straight ones as much as you can. Hopefully that will help remove. You can do blunt dissection to remove. And make sure that you got the entire 4 centimeters of the rod out, the no pieces remaining inside the skin. Apply the bandage, pressure bandage. That's it. I can choose to, if the patient wants, use the same entry site to insert the new replacement subdermal implant right away as well.